Describe how atomic binding energy affects the interaction of radiation with matter. Why is it important in medical imaging? Answer: atomic binding energy refers to the energy required to remove an electron from its atomic orbital. It is critical in determining how atoms interact with ionizing radiation. The significance of atomic binding energy lies in its role in various interactions between X-ray photons and matter, notably photoelectric effect. This occurs when an X-ray photon is completely absorbed by an atom, resulting in the ejection of an inner shell electron. The likelihood of this interaction is higher when the energy of the incoming photon is slightly above the binding energy of the electron. Therefore, tissues with higher atomic numbers, like bone, are more likely to absorb X-rays due to their higher binding energies compared to softer tissues like muscle. Compton scattering. This involves an X-ray photon interacting with an outer shell electron, resulting in partial energy transfer and scattering. The degree of this interaction also varies with atomic binding energy, but it is less dependent than the photoelectric effect. In medical imaging, understanding atomic binding energy is crucial for optimizing contrast. For example, the use of contrast agents like iodine, high atomic number enhances image contrast because they have higher binding energies and result in more photoelectric interactions, leading to improved visibility of vascular structures or organs. Dr. Susan is performing an X-ray imaging procedure on a patient with a pacemaker. The energy settings for the X-ray tube are set at 100 kVp and 300 mA. Considering the pacemaker, what should Dr. Susan consider regarding beam filtration and patient safety? Answer: in this scenario, Dr. Susan must prioritize both the effective imaging of the target area and the safety of the patient with a pacemaker. Key considerations include beam filtration. Purpose: filtration is used to remove low-energy photons from the X-ray beam. These photons do not contribute to image quality but can increase the patient's radiation dose unnecessarily. Material: typically aluminum filters are used. The filtration must ensure that only higher energy and therefore more penetrating X-rays pass through, which improves image quality while minimizing patient dose. Recommended filtration. For X-ray machines operating above 7 kV, a minimum total filtration of 2.5 mm of aluminum is standard. Impact of high AV. A setting of 100 kVp indicates that the X-ray beam is more penetrating. Dr. Susan should ensure that the settings are appropriate for the patient's body habitus and the area being examined. Interaction with pacemaker. Dr. Susan should refer to the pacemaker manufacturer's guidelines regarding exposure to radiation. High-energy radiation can potentially interfere with the electronic components of the device, so it is essential to minimize exposure to the region of the pacemaker. Collimation and shielding. Proper collimation can further limit the exposure area to just the region of interest, thus protecting the pacemaker from unnecessary radiation. Lead shields or aprons can be employed to provide additional protection to the pacemaker and surrounding tissues. By considering these factors, Dr. Susan can ensure a balance between achieving quality images and safeguarding the patient's health. Explain the difference between bremsstrahlung and characteristic radiation in X-ray production. How do they contribute to the overall X-ray spectrum? Answer: X-ray production occurs primarily through two processes: bremsstrahlung radiation and characteristic radiation. Bremsstrahlung radiation process: when high-speed electrons from the cathode collide with the tungsten target in the anode, they are decelerated by the strong electric field of the nucleus. This sudden change in speed causes the electrons to lose energy, which is emitted as X-ray photons. The emitted radiation has a continuous spectrum of energies depending on how much energy was lost during the interaction. Contribution to spectrum. Bremsstrahlung radiation comprises the majority of the X-ray output. In a typical diagnostic imaging scenario, it produces a broad, continuous range of photon energies, which is depicted as a curve on the X-ray spectrum graph. Characteristic radiation process. Characteristic radiation occurs when an incident electron collides with an inner shell electron of the target atom, causing the ejection of that electron. When an outer shell electron fills this vacancy, energy is released in the form of a photon. The energy of this photon is specific to the difference in binding energies between the two shells. Contribution to spectrum. Characteristic radiation appears as discrete peaks on the X-ray spectrum graph indicating specific photon energies. In tungsten, for example, notable peaks appear around 58 keV/K and 68 keV/kb. Overall, the combination of bremsstrahlung and characteristic radiation creates a comprehensive X-ray spectrum. The continuous spectrum from bremsstrahlung allows for variable energy levels, while the specific energies from characteristic radiation contribute defined peaks that can be utilized for imaging different tissues effectively. ecofluoroscopy procedure. Explain the concept of a half-value layer HVL and how it is applied to optimize radiation protection for patients and staff. Answer: the half-value layer HEL is a crucial measure in radiology that indicates the thickness of a specified material, often aluminum, required to reduce the intensity of an X-ray beam to half of its original value. Importance of HVL: radiation penetration. HVL is used to quantify the penetrating ability of an X-ray beam. A higher HVL indicates that the beam has greater energy and can penetrate more tissue. Beam quality assessment. It is also an indicator of beam quality. A higher HVL corresponds to a higher energy beam, which typically results in a lower patient dose since more low energy, less penetrating photons have been filtered out. Application in radiation protection. Optimizing filtration. In fluoroscopy, proper filtration can increase the HVL, which helps to minimize the dose to the patient and staff by removing unnecessary low-energy X-ray photons that do not contribute to image quality. This adjustment is vital for reducing the overall exposure and preventing unnecessary radiation risk. Determining safety protocols. Understanding HVL allows radiologic technologists to assess and select appropriate shielding materials and techniques, e.g., lead aprons, to protect against scatter radiation. Knowing the HVL for a specific X-ray beam enables the design of adequate safety measures in the imaging environment. Quality control measures. Regular HVL measurements are part of quality control protocols to ensure that X-ray machines are operating within safe and effective parameters, thus safeguarding both patient and operator. By understanding and applying the concept of HVL, healthcare professionals can better manage radiation exposure and enhance patient safety. Mr. Johnson is a radiation technologist who is tasked with reducing scatter radiation during a pelvic X-ray procedure. The patient is concerned about radiation exposure. What methods can Mr. Johnson use to minimize scatter radiation, and how do these methods affect image quality? Answer: Mr. Johnson can employ several strategies to minimize scatter radiation during a pelvic X-ray procedure, thereby addressing the patient's concerns regarding radiation exposure. Use of grids. Function. Grids are devices composed of thin strips of lead and spacers that absorb scattered radiation while allowing primary radiation to pass through. Impact on dose and image quality. While grids improve image contrast by reducing scatter, they require an increase in radiation dose to maintain adequate image brightness since some primary photons are also absorbed. Collimation. Function. Collimating the X-ray beam involves adjusting the X-ray tube's field size to the area of interest, which limits the radiation exposure to only the necessary tissues. Impact on dose and image quality. Collimation significantly reduces scatter radiation generated from the irradiated tissues and enhances image contrast without increasing the dose. A gap technique. A function. This method involves increasing the distance between the patient and the image receptor, allowing scattered photons to diverge away from the detector. Impact on dose and image quality. While this technique can reduce scatter, it can also lead to magnification and potential loss of sharpness if not carefully managed. The effectiveness of this technique depends on maintaining proper imaging distances, lowering KVP. Function. Reducing the KVP decreases the energy of the X-ray photons, resulting in fewer Compton-scatter interactions. Impact on dose and image quality. While lowering KVP reduces scatter and can enhance contrast, it also decreases penetration, which may require an increase in or exposure time to maintain adequate image brightness. By employing these methods, Mr. Johnson can effectively reduce scatter radiation, ensuring both image quality and patient safety are prioritized. How does Compton scattering affect image quality in diagnostic imaging? What factors influence the extent of Compton scattering? Answer: Compton scattering plays a significant role in diagnostic imaging and can influence image quality in various ways. Impact on image quality. Noise introduction. Compton scattering occurs when an X-ray photon interacts with an outer shell electron, resulting in scattered photons that can contribute to image noise and degrade overall image quality. Contrast reduction. The scattered photons can interfere with the detection of primary radiation, leading to a decrease in contrast between different tissues. This can make it more challenging to differentiate structures, especially in areas where there is a high degree of overlap, e.g., abdomen penetration versus scattering. If the X-ray beam is too energetic, high KVP, more Compton scattering may occur without sufficient penetration, potentially affecting image sharpness and diagnostic value. Factors influencing Compton scattering. Photon energy. Higher energy photons from higher KVP settings are more likely to undergo Compton scattering rather than photoelectric absorption, leading to increased scattering events. Tissue composition. The atomic number and density of the tissue being imaged influence the probability of Compton interactions. For example, soft tissues with lower atomic numbers will scatter less than denser tissues like bones. Angle of interaction. The angle at which X-ray photons scatter can also affect the extent of Compton scattering. Photons that are scattered at wider angles may have their energy reduced, leading to lower quality images. By understanding Compton scattering and its influence on image quality, technologists can optimize imaging protocols to balance between adequate penetration and reduced scatter, ultimately enhancing diagnostic effectiveness. Define stochastic and deterministic effects of radiation exposure. Provide examples of each and discuss their significance in radiation safety. Answer. Radiation exposure can lead to two types of effects: stochastic and deterministic, each with distinct characteristics and implications for radiation safety. Stochastic effects. Definition: stochastic effects are those that occur by chance and are not directly related to the dose received. The probability of occurrence increases with dose, but the severity of the effect is not dose-dependent. Examples: cancer. The risk of developing cancer is a classic example of a stochastic effect. Even low doses of radiation can increase the risk over a lifetime. Genetic mutations. Mutations in germ cells can lead to hereditary effects which may manifest in future generations. Significance in radiation safety. Stochastic effects emphasize the need for minimizing radiation exposure, particularly at low doses, because any exposure carries some risk of these long-term effects. This principle underpins that ALARA as low as reasonably achievable concept in radiation safety. Deterministic effects. Definition: deterministic effects have a threshold dose and become more severe with increasing exposure. These effects are typically associated with high doses of radiation and are directly related to the amount of radiation received. Examples: radiation burn. A high dose of radiation can cause skin burns, with severity depending on the dose and duration of exposure. Acute radiation syndrome (ARS). High doses delivered over a short period can result in ARS, characterized by symptoms such as nausea, vomiting, and potential death. Significance in radiation safety. Understanding deterministic effects is crucial for setting dose limits and safety protocols. Protective measures are implemented to prevent exposure from exceeding threshold levels that could cause these acute effects. In summary, both stochastic and deterministic effects are critical to radiation safety considerations. Emphasizing the reduction of exposure helps mitigate both immediate and long-term risks associated with ionizing radiation. Discuss the role of lead shielding in radiation protection. How does it function, and what factors determine its effectiveness? Answer: lead shielding is a fundamental component of radiation protection utilized to reduce exposure to ionizing radiation from sources such as X-ray machines and radioactive materials. Function of lead shielding: attenuation of radiation. Lead is a dense material with a high atomic number, making it effective at attenuating, reducing the intensity of X-rays and gamma rays. When radiation encounters lead, it interacts with the electrons in the lead atoms, resulting in absorption and scattering. Prevention of scatter radiation. Lead shields not only protect against direct radiation, but also help minimize the exposure to scatter radiation that may arise from interactions within the patient or surrounding tissues. Factors determining effectiveness. Material thickness. The thickness of the lead shield is a critical factor. The effectiveness of shielding increases with thickness, but diminishing returns apply, as doubling the thickness does not necessarily result in having the radiation exposure. Type of radiation. Lead is particularly effective against X-rays and gamma rays. However, it is less effective against neutron radiation, requiring alternative materials, e.g. polyethylene, for effective shielding against such particles. Energy of radiation. Higher energy photons require more substantial lead shielding to achieve the same level of attenuation as lower energy photons. The half-value layer concept is often applied to determine the necessary thickness based on photon energy. By understanding the role and effectiveness of lead shielding, medical radiation technologists can implement proper shielding strategies to safeguard patients and healthcare workers from unnecessary radiation exposure. Explain the principles of ALARA and its importance in the context of radiation safety in medical imaging. Answer: ALARA stands for as low as reasonably achievable, a guiding principle in radiation safety that aims to minimize radiation exposure to patients, healthcare workers, and the general public while ensuring that diagnostic or therapeutic benefits are achieved. Principles of ALARA: optimization. The primary aim of ALARA is to optimize radiation protection by using appropriate techniques, equipment, and protocols to ensure that exposures are kept as low as possible while achieving the necessary diagnostic information. Justification. Every use of radiation must be justified by weighing the potential benefits against the risks. This involves assessing whether the expected health benefit outweighs the radiation exposure risk. Dose limitation. Implementing dose limits for different exposure categories, e.g., occupational exposure for staff versus exposure for patients, to ensure that radiation levels remain within acceptable safety thresholds. Importance in medical imaging. Patient safety. By adhering to ALARA principles, healthcare providers can protect patients from unnecessary radiation exposure, particularly for vulnerable populations such as children and pregnant women, where the risk of stochastic effects is heightened. Staff protection. Radiology staff are regularly exposed to radiation, so ALARA practices help in minimizing their occupational dose, thereby safeguarding their long-term health. Regulatory compliance. ALARA is not only a best practice but also a regulatory requirement in many jurisdictions. Compliance with ALARA guidelines supports adherence to safety standards set by organizations like the Canadian Nuclear Safety Commission, CSA, and Health Canada. By integrating ALARA principles into daily practice, medical imaging professionals can ensure responsible use of radiation while maximizing diagnostic efficacy and minimizing risk. Explain the concept of ionization and how it is relevant to the use of X-rays in medical imaging. Why is ionization both beneficial and hazardous? Answer. Ionization is the process by which an atom gains or loses an electron, resulting in the formation of charged particles, ions. This process is central to the interaction of X-rays with matter and has significant implications in medical imaging. Relevance in medical imaging. Image formation. In medical imaging, X-rays are generated and directed towards the patient. When these high-energy photons interact with the tissues, they can cause ionization by displacing electrons. Contrast mechanism. Denser tissues, such as bone, absorb more X-rays due to greater ionization effects, leading to clearer images compared to softer tissues, which may transmit more photons, resulting in less contrast. Benefits of ionization. Diagnostic value. The ability to create high-contrast images of internal anatomy is invaluable for diagnosis, treatment planning, and monitoring of various conditions, such as fractures, tumors, and infections. Therapeutic applications. In some cases, ionizing radiation is employed therapeutically, such as in cancer treatment, where it targets and destroys malignant cells through ionization-induced damage. Hazards of ionization. Biological damage. While ionization is useful for imaging and treatment, it can also cause cellular and DNA damage, leading to potential acute and long-term health risks, including cancer. Radiation protection needs. The potential for harmful effects necessitates strict adherence to radiation protection protocols to minimize exposure to patients and staff. This includes the use of lead shielding, proper technique, and adherence to ALARA principles. In summary, while ionization is a critical component of X-ray imaging that enables effective diagnosis and treatment, it carries inherent risks that must be carefully managed to ensure safety for all involved. What is the key difference between stochastic and deterministic effects of ionizing radiation, and how do these effects manifest in the human body? Answer. The fundamental difference between stochastic and deterministic effects lies in the relationship between dose and effect. Stochastic effects are probabilistic, meaning that the probability of occurrence increases with dose, but the severity of the effect does not. These include long-term consequences like cancer, induction, and genetic mutations. There is no threshold dose for stochastic effects, meaning that any amount of radiation could theoretically cause harm, but the likelihood increases with dose. The key examples are cancer and hereditary effects. Deterministic effects, also known as tissue reactions, are characterized by a threshold dose below which the effect does not occur. Above the threshold, the severity of the effect increases with dose. These effects are typically seen in high doses and include skin erythema, cataracts, and acute radiation syndrome. Relevant guidelines and laws. According to the International Commission on Radiological Protection (ICOP) guidelines, stochastic effects are governed by the principle of minimizing dose as low as reasonably achievable, whereas deterministic effects are managed by adhering to established dose limits to prevent tissue reactions. Mr. Martinez, a radiologic technologist, is preparing to perform a fluoroscopy-guided interventional procedure. The procedure is expected to expose the patient to a substantial amount of ionizing radiation. Considering the deterministic effects of radiation, what steps should Mr. Martinez take to minimize the patient's risk, and what threshold effects should he be particularly cautious of? Answer. Mr. Martinez must take several precautionary measures to minimize deterministic effects, including reducing exposure time, limiting the duration of the fluoroscopy to minimize the total radiation dose, maximizing distance, keeping the imaging source as far as practical from the patient, and using shielding where possible. Using appropriate shielding, employing lead shields to protect sensitive organs and tissues not involved in the procedure, optimizing equipment settings, using the lowest possible dose settings that provide adequate image quality, deterministic effects to be aware of, skin erythema. This is one of the early deterministic effects with a threshold dose around 2 GI, cataracts. Repeated or prolonged high exposures to radiation, particularly to the head or eyes, may increase the risk of cataract formation with a threshold dose of approximately 0.5 GI for the lens of the eye in fractionated exposures. Describe the process and significance of cellular repair mechanisms in response to sublethal radiation damage. What factors can affect the success of these repair processes? Answer: cellular repair mechanisms are crucial in mitigating the damage caused by sublethal doses of ionizing radiation. When cells are exposed to radiation, they activate a variety of repair processes to fix damaged DNA strands, including base excision repair, fixes small, non-helix distorting base lesions; nucleotide excision repair, repairs bulky DNA lesions such as those caused by UV radiation; non-homologous end joining, NHEDGE, a primary mechanism for repairing double-strand braid DBS, though prone to errors; homologous recombination, HA, a high-fidelity repair mechanism for DCBS using a homologous sequence as a template, factors influencing success. Cell cycle stage. Cells are most radiosensitive during the GM phase and most resistant during the late S phase. Oxygen effect. The presence of oxygen enhances radiosensitivity by promoting the formation of free radicals, which cause more damage. ESLIN, the differences between linear and nonlinear radiation dose-response curves. How are these models used to understand radiation effects in medical settings? Answer: linear dose-response curve. In this model, the effect e.g. cancer risk increases proportionally with the dose. It is commonly applied to stochastic effects, such as cancer induction, assuming that there is no safe threshold and any radiation exposure carries some risk. This is the basis for the linear no-threshold LNT model used in radiation protection. Nonlinear dose-response curve. This model shows that the relationship between dose and effect is not proportional. Nonlinear curves are often used for deterministic effects where there is a threshold dose below which no effect occurs. Beyond the threshold, the severity of the effect increases rapidly. Application in medical settings. Linear models guide policies for minimizing radiation exposure in diagnostic imaging. Nonlinear models help establish safe dose limits for therapeutic radiation to avoid tissue damage. Deterministic effects. In the context of genetic mutations induced by ionizing radiation, explain the difference between somatic and germline mutations and the long-term implications for human health. Answer: somatic mutations. These occur in non-reproductive cells and affect only the individual exposed to radiation. The most significant consequence of somatic mutations is the potential development of cancers. Since somatic mutations are not passed to offspring, their impact is limited to the exposed individual. Germline mutations. These occur in reproductive cells, sperm or eggs, and can be passed on to future generations, potentially leading to hereditary diseases or increased cancer risk in descendants. Long-term implications. Somatic mutations may lead to late-onset cancers in the exposed individual. Germline mutations raise concerns about the health of future generations, with an increased risk of genetic disorders or predispositions to certain diseases. Relevant law and guidelines. Radiation safety protocols, such as those established by the Nuclear Safety and Control Act (NSSCA), focus on minimizing both somatic and germline mutations by strictly controlling radiation exposure, especially in reproductive age individuals. Ms. Johnson is a healthcare worker in a radiation oncology department. She is frequently exposed to low levels of ionizing radiation. Over time, she develops cataracts in both eyes. Based on your understanding of stochastic and deterministic effects, explain why this occurred and what guidelines could have helped minimize this risk. Answer: Ms. Johnson's cataract formation is an example of a deterministic effect of radiation exposure. Cataracts are a known consequence of prolonged exposure to ionizing radiation, particularly to the eyes, and have a threshold dose of around 0.5 GI for fractionated exposures. As a healthcare worker, Ms. Johnson likely accumulated radiation exposure over time that exceeded this threshold. Preventative measures, using lead glasses and maximizing distance from the radiation source, could have helped reduce her exposure. Regular monitoring of cumulative dose via personal dosimeters would ensure that her exposure remained below the safe limits for deterministic effects. Relevant guidelines. The ICRP and Canadian Nuclear Safety Command CSO recommend strict occupational exposure limits and protective measures, such as shielding and monitoring, to prevent such deterministic effects. What is acute radiation syndrome (ARS) and what are the different dose ranges and associated syndromes involved in ARS? Answer: acute radiation syndrome (ARS) occurs after exposure to a high dose of ionizing radiation over a short period. ARS is characterized by three main syndromes based on the dose range received. Hematopoietic syndrome 1-10-GI affects the bone marrow, leading to a drop in blood cell production, resulting in immunosuppression, anemia, and bleeding. Death may occur at doses above 5 GI without treatment. Gastrointestinal syndrome 1050-GI damages the lining of the GI tract, leading to severe nausea, vomiting, diarrhea, and sepsis. The survival rate is very low even with medical intervention. Central nervous system (CNS) syndrome 50 GI leads to irreversible damage to the brain and spinal cord, causing confusion, seizures, and loss of consciousness, typically resulting in death within hours to days. Discuss the factors that influence radiosensitivity in cells. Why are certain cells more radiosensitive than others? Answer: radiosensitivity of cells is influenced by several key factors. Cell cycle. Cells are most sensitive to radiation during the G and M phases of the cell cycle when DNA is being replicated or divided. Oxygen effect. Cells exposed to oxygen during irradiation are more radiosensitive because oxygen enhances the formation of free radicals, which cause more extensive DNA damage. Cell differentiation. Stem cells and undifferentiated cells, such as bone, marrow, and reproductive cells, are more radiosensitive than mature, fully differentiated cells like neurons or muscle cells. Reproductive rate. Cells that reproduce more frequently, e.g., intestinal lining cells, are more radiosensitive due to the increased likelihood of DNA replication errors. How do threshold and non-threshold models impact the establishment of radiation safety standards? Provide examples of how these models are applied in practice. Answer: the threshold model and non-threshold model are two fundamental concepts in radiobiology that have significant implications for establishing radiation safety standards. Threshold model. This model posits that there is a specific dose below which no adverse effects occur. This is particularly relevant for deterministic effects, such as skin burns or cataracts, where a minimum dose must be exceeded for damage to manifest. Safety standards based on the threshold model establish dose limits that ensure exposures remain below this critical level to prevent immediate health effects. Example: in medical imaging, protocols are designed to keep radiation exposure below established thresholds that could lead to deterministic effects. For instance, regulatory bodies might set a limit for annual occupational exposure to ensure that workers do not exceed doses that would risk skin erythema, typically above 2 GI. Non-threshold model. In contrast, the non-threshold model assumes that any amount of radiation exposure carries some risk for stochastic effects, such as cancer. This model is foundational for radiation protection standards, emphasizing the need for minimizing exposure irrespective of how small the dose may be. Example: the concept of ALARA as low as reasonably achievable is based on the non-threshold model. In clinical practice, this means that radiation exposure for patients and healthcare workers should be minimized to reduce cancer risk. For instance, during fluoroscopic procedures, healthcare professionals implement various strategies to limit exposure time and utilize shielding, ensuring that every possible measure is taken to keep doses as low as practicable. Regulatory guidelines. Organizations like the International Commission on Radiological Protection (ICOP) and the Canadian Nuclear Safety Commission (CSC) utilize these models to formulate comprehensive guidelines that govern radiation safety practices in medical settings, aiming to protect patients and healthcare workers from both deterministic and stochastic effects. What is the role of dose-response relationships in radiobiology, and how do they affect treatment planning in radiation therapy? Answer: dose-response relationships are critical in radiobiology, determining how living tissues respond to varying levels of radiation exposure. These relationships help clinicians understand and predict the effects of radiation on both tumors and normal tissues, influencing treatment planning in radiation therapy. Characterizing tissue sensitivity. Different tissues exhibit varying degrees of sensitivity to radiation based on their biological characteristics, such as cell type, proliferation rate, and tissue architecture. Understanding these characteristics allows for more informed decisions in treatment planning. Optimizing dose delivery. The dose-response relationship is essential for determining the optimal dose required to achieve a therapeutic effect on a tumor while minimizing damage to surrounding healthy tissue. Treatment planning aims to maximize the tumor control probability (TCP) and minimize the normal tissue complication probability (TEP). Fractionation strategies. Knowledge of dose-response relationships informs fractionation schedules, which dictate how radiation is delivered over multiple sessions. The linear quadratic model is often employed to assess the biological effects of different fractionation schemes. Example, in prostate cancer treatment, a common fractionation schedule involves delivering low doses over several weeks, allowing normal tissues to repair between treatments while continuously targeting the tumor. Assessing treatment outcomes. Dose-response relationships facilitate the prediction of treatment outcomes, such as tumor shrinkage and the likelihood of side effects. This predictive capability enables clinicians to tailor treatment plans based on individual patient responses and tumor characteristics. Balancing risks and benefits. By understanding the dose-response relationship, healthcare providers can better assess the risks and benefits of radiation therapy for individual patients. This assessment is crucial for making informed decisions about treatment options, especially in cases where the potential for complications exists. Regulatory and clinical guidelines. Professional organizations such as the American Society for Radiation Oncology (ASTRO) provide guidelines that integrate dose-response relationships into clinical practice, promoting evidence-based treatment protocols that enhance patient safety and treatment efficacy. Explain the ALARA principle and its significance in medical radiation protection. How does it apply in practice when performing diagnostic imaging? Answer: the ALARA principle stands for as low as reasonably achievable and is a fundamental concept in radiation protection. It mandates that radiation exposure to patients, staff, and the public should be kept to the minimum possible level while still achieving the desired medical outcome. In practice, ALARA is implemented through optimization of exposure, selecting the lowest possible radiation dose that still provides diagnostically useful images, time, distance, and shielding, reducing the time of exposure, increasing the distance from the source of radiation, and using protective barriers such as lead aprons, thyroid shields, or walls. Collimation, restricting the size of the X-ray beam to the area of interest only, reducing exposure to surrounding tissues. Use of high-speed image receptors. These reduce the amount of radiation needed to produce quality images. Dr. Lewis, a radiologist working in an interventional suite, has accumulated a radiation dose of 30 MSV in the first 6 months of the year. According to Canadian guidelines, what steps should be taken to manage Dr. Lewis's radiation exposure for the remainder of the year, and what are the potential risks if this exposure continues unchecked? Answer: in Canada, the annual occupational exposure limit for radiation workers is 50 MSV per year as per the CNSC regulations. Given that Dr. Lewis has already accumulated 30 MSV in the first 6 months, steps must be taken to reduce further exposure. Modify work habits. Reduce Dr. Lewis's time in high radiation areas by redistributing procedures among other staff members. Enhance protection measures. Ensure that Dr. Lewis uses all available protective equipment, such as lead aprons, thyroid shields, and increasing distance from radiation sources. Personal dosimetry monitoring. Continuously monitor Dr. Lewis's exposure using dosimeters to ensure it does not exceed the annual limit. If Dr. Lewis's exposure continues unchecked, the risks include radiation-induced cancer, cataracts, and other long-term health effects. What are the regulatory limits for public radiation exposure, and what additional precautions must be taken for pregnant workers to protect the fetus? Answer: the Canadian public dose limit for radiation exposure is set at 1 MSV per year, as recommended by the CNSC. For pregnant workers, the limit for fetal exposure is much lower, typically 0.5 MSV during the pregnancy, to minimize the risk to the developing fetus. Precautions for pregnant workers include reassignment to lower exposure tasks. Pregnant workers may be reassigned to roles with minimal radiation exposure, increased use of shielding. Ensure adequate use of lead shielding, particularly around the abdomen, to protect the fetus. Frequent monitoring. Dosimeters should be worn to ensure that fetal exposure does not exceed recommended limits. Failure to adhere to these guidelines can lead to increased risks of fetal malformation, growth retardation, or radiation-induced cancer later in life. Discuss the role of beam collimation in reducing radiation exposure during radiographic procedures. Why is collimation critical in achieving the ALARA principle? Answer: beam collimation refers to the narrowing of the X-ray beam to limit its exposure to the area of interest. Collimation is a vital tool in reducing unnecessary radiation exposure and is critical for adhering to the ALARA principle. Reduces patient exposure by focusing the radiation only on the area that needs imaging, thus preventing adjacent tissues from being unnecessarily exposed. Improves image quality by reducing scatter radiation, which can degrade the image. Minimizes staff exposure since less scattered radiation reaches the technologist or radiologist. Collimation is mandatory according to most regulatory guidelines, including Health Canada's Safety Code 35, which mandates the use of collimation in all diagnostic imaging procedures to limit patient dose. Describe the proper procedures for the safe storage and disposal of radioactive materials in a radiology department and discuss the regulatory guidelines that govern these practices. Answer: safe storage and disposal of radioactive materials are governed by guidelines from the CNSC and Health Canada. Key practices include storage. Radioactive sources must be stored in lead-line containers and secured in a designated area with restricted access. The storage area must have adequate shielding and warning signs to prevent unauthorized access. Inventory tracking. Regular tracking of all radioactive sources is required to ensure none are misplaced or improperly handled. Disposal. Radioactive waste must be segregated and disposed of in compliance with CNSC regulations. Low-level waste can be disposed of after proper decay, while higher-level waste must be sent to licensed disposal facilities. Failure to comply with these regulations can lead to contamination, radiation exposure incidents, and legal penalties for the institution. Mrs. Thompson, a radiology technologist, notices a discrepancy in her dosimeter report, which shows an unusually high dose over the past month. What steps should Mrs. Thompson take to address this issue, and how should the department proceed in investigating the discrepancy? Answer: Mrs. Thompson should immediately report the discrepancy to her department's radiation safety officer. Steps that should be taken include investigation of exposure, review the working conditions during the time period in question to determine whether there were any incidents or changes in procedures that could explain the high reading. Dosimeter check, verify whether there was a malfunction or incorrect handling of the dosimeter. This may involve recalibrating or replacing the device, monitoring of colleagues. Compare dose readings with those of other workers in the same environment to assess whether the exposure is widespread. Follow-up. Depending on the findings, Mrs. Thompson may need to undergo a medical evaluation if the dose exceeded acceptable limits. The department should also ensure that procedures are reinforced to prevent future discrepancies following CNSC guidelines for radiation monitoring and safety. What techniques can be used to minimize radiation dose to patients during fluoroscopic procedures, and what role does the use of fast image receptors play in radiation protection? Answer: minimizing radiation dose to patients during fluoroscopy involves several techniques. Intermittent fluoroscopy. Instead of continuous imaging, using fluoroscopy in short bursts can significantly reduce patient dose. Last image hold allows the technologist to use the last captured image for evaluation instead of taking additional images. Fast image receptors. These reduce the amount of radiation required to obtain a high-quality image, which in turn minimizes the patient's exposure. Fast image receptors are designed to be more sensitive to X-rays, allowing for shorter exposure times. Collimation and beam filtration. Properly collimating the beam to the area of interest and using filters to remove low-energy photons also helps reduce dose. The combined application of these techniques aligns with the ALARA principle, ensuring patient safety while achieving necessary diagnostic outcomes. Discuss the key regulatory guidelines that govern the operation of radiology departments in Canada. How do these regulations impact the daily operations of medical radiation technologists? Answer: key regulatory guidelines that govern radiology departments in Canada include Safety Code 35, provides standards for the use of X-ray equipment and establishes the operational requirements for radiation safety. CNSC regulations oversee the licensing of facilities using radioactive materials and ensure compliance with safety standards. Health Canada guidelines focus on the protection of patients and staff, promoting the ALARA principle and ensuring proper training and competency of radiation personnel. These regulations impact daily operations by requiring regular training. Medical radiation technologists must undergo ongoing education to stay current with safety practices and technological advancements, routine audits and inspections. Departments must perform self-assessments and be subject to external inspections to ensure compliance with radiation safety standards. Documentation. Accurate records of radiation exposure, equipment maintenance, and safety training are mandated to ensure accountability and traceability. How important is informed consent in radiology procedures, and what steps should technologists take to ensure patients understand the risks and benefits of a procedure? Answer: informed consent is crucial in radiology procedures as it ensures that patients are aware of the nature of the procedure, the associated risks, benefits, and alternatives. This process is vital for ethical practice and legal compliance. Steps technologists should take include clear communication, use layman's terms to explain the procedure, avoiding medical jargon. Ensure the patient understands the purpose of the imaging and the need for it. Discuss risks and benefits. Clearly outline potential risks, including radiation exposure, and weigh them against the expected benefits of the procedure. Allow questions. Encourage patients to ask questions and express any concerns they might have about the procedure. Obtain written consent. Document the informed consent process, ensuring that the patient signs a consent form acknowledging their understanding and agreement to proceed. By taking these steps, technologists help empower patients, fostering trust and cooperation while ensuring legal and ethical compliance. Discuss the relationship between image quality and radiation dose in diagnostic imaging. What strategies can be employed to optimize both? Answer: there is an inherent relationship between image quality and radiation dose in diagnostic imaging. Generally, higher radiation doses can improve image quality, but the goal is to achieve optimal quality while minimizing exposure. Strategies to optimize both include quality control programs. Regularly perform quality control tests on imaging equipment to ensure optimal performance and image quality. Use of advanced technology. Implement digital imaging systems that require lower doses while producing high-quality images. Automatic exposure control. Utilize AEC systems to adjust the radiation dose automatically based on the patient's size and the required image quality, ensuring adequate exposure without excess. Post-processing techniques. Utilize software that can enhance image quality after acquisition without additional radiation exposure. By carefully balancing these factors, radiology departments can improve patient safety while maintaining diagnostic effectiveness.